Okay. As soon as my computer decides to share the screen. Sorry, guys, my computer's being a little slow. What do you guys see right now?
Blank screen.
It's about to start. It says Dr. Wayne Carney has started screen sharing. I just think it's just running slow.
Okay, I'll just give it a minute then. Maybe 2 minutes. All right, what are you guys seeing now?
Like screen.
Still a blank screen, huh?
There you go, nerve glides.
Nerve glides, perfect. That's what we're going for. Awesome. All right, so first of all, I want to start off with a little bit of anatomy, okay, just so you guys kind of understand what we're looking at here. So if we look here, this is the bottom of what we call our cervical spine, okay? This is right around the base of your neck, okay? Specifically C5 through T1. These are all the nerve roots coming out of the spine, okay? These nerve roots form what we call this plexus, okay? So it comes out through here and they branch off and combine with other ones, and it just does a whole bunch of crazy stuff right around the crook of our neck. So you can see it's located right around in here. So we can see there's a lot of muscles that kind of run through here, right? So we have our upper trap that can be in that area. What we call the scalene muscles, those run in through here. One of the stretches we did in one of the previous sessions, the levator scap, can run through here. So another reason why that's an important stretch. Then we have our pectoral muscles. They come up in here and attach to the shoulder. So they can run across these nerves. And then all the way down. Okay, so you can see this plexus, combines and separates and comes all the way down. And 3 of the main nerves that branch off are the 3 nerves we're going to talk about today. Okay, so you can see those 3 branches. And it's going to run down to these 3 main nerves. Okay. The first one we're going to talk about is the median nerve. Okay, that runs right down the front of your arm, kind of right in the middle of your elbow, down through the middle of your wrist. Okay, so right in the middle of your wrist is where we're going to get that carpal tunnel. That's where things are going to tighten up and compress on that nerve, and we're going to get all of the things that result from carpal tunnel. Then you have the ulnar nerve. Okay, that's your funny bone, right? Anybody ever bump their elbow and then all of a sudden you feel that tingling all the way down into your little finger? That's your ulnar nerve. Okay, so we'll touch on that one a little bit. And then the least common one, but some people do experience it, is the radial nerve. So that goes on the back of your hand. You can see there it kind of twists around our humerus, that upper arm bone, and it goes to the back of our arm and hand. Okay. So take a look at this picture here. So if you are experiencing any sort of numbness or tingling down into your hands, these are the patterns that you'll typically see. Okay. So if we're experiencing median nerve issues, we're going to feel it right in the palm of our hand. We're going to feel it in our index and middle finger, and then half of this ring finger, okay? And then maybe even a little bit into the thumb. That's the typical distribution on the palm side. And on the back, you'll see it's the tip of these 2 fingers and this one. You don't typically feel it there as much. This is where you notice it more. Then you have your ulnar nerve. This is, again, your funny bone. Whenever you hit your elbow just right and you get that tingly down into these fingers here, this 1.5. Again, that's your ulnar nerve. Okay. And then, like I said, the less common one, the radial nerve, you'll experience that kind of more in the back of the hand, a little bit on the outside of the thumb. Okay. So there's the anatomy. That's what we're kind of looking at here. If you're experiencing any of these frequently, pay attention to the one that I'm doing and kind of focus on that, because some of these movements are a little bit challenging. I don't have pictures for them just because pictures don't really do the movements justice. You kind of got to just walk through them and make sure you do all the components. So if this is something that you're like, hey, this is something that would benefit me, I'd be happy to meet with you and actually walk you through and kind of coach you through the technique if you think this will be beneficial to you. So I'm going to stop sharing here. You guys see me now? Okay.
Yes.
All right, so let's go ahead and start with the old median nerve, okay? So the first thing I want to teach you is a test for it. Slide all the way over here. So for the test on the median nerve, your arm's you want your shoulder down, okay? Don't ever let your shoulder come up. We want our shoulder down, okay? Then you're gonna make sure your elbow is extended. You're gonna extend your wrist and fingers, okay, as much as you can. And then you're gonna tilt your head away. And you're gonna hold that for 5-6 seconds. It won't take long if you have an issue that you're gonna feel just a weird sensation down into that pattern that I showed you, right? Down into the kind of the palm and these two fingers in here. I feel it right there. Okay, so if that's something you're feeling, what we wanna basically do is grab that nerve, and we actually call it nerve flossing, because you're taking it from both ends and you're kind of pulling it back and forth. So if we have anything that's forming a restriction in there, or if it's stuck within a muscle, we can grab that nerve and kind of pull it ever so slightly and get it moving a little bit better, okay? So that's kind of why I touched on the anatomy, that it actually starts up here, because some of the movements we're gonna do involve the head. So to the median nerve, we're testing it here, okay? Oop, there's my tingling, I feel it already. So to do the flossing, to do the glide, I'm gonna start by going here, okay? I think you're doing flossing wrong. Is it this one? You want me to do this one? Is that, no? Okay. So here's the test. So now to start the floss, I'm gonna move my head back to this side. That's gonna alleviate some tension. Okay. And now I'm really pulling on this end of the leg. Okay. And I'm gonna tilt my head as I flex my arm and wrist. Okay. So I'm gonna go here and kind of go back and forth. And you're gonna do it about 10-15 times. Okay, that's gonna get that median nerve gliding a little bit. Any questions on that one? So again, testing it, we're going away from each other, wrist, hands, elbow, and head all going away. Now to start the glide, we're gonna start in this position, kind of alternate these two movements. Okay, this is a really good movement to keep that median nerve moving so that we can decrease the chance of, carpal tunnel type symptoms. Okay, median nerve. Now we're gonna move on to ulnar nerve. This is the one where I have the issues. I was a baseball player my whole life, so I have a lot of inflammation and scar tissue and stuff built up in my elbow. So a lot of that kind of culminates right there where that ulnar nerve wants to run through. So I can just be sitting, working on the computer, and all of a sudden just numb and tingly all the way down to my little finger. And I gotta get up and shake my hand out because it just drives me nuts, okay? So the way you test this one, I like to call it the Batman, okay? Remember when you were a kid and you would do this, right? I am Batman, right? So we wanna do that with one hand, okay? So take that up over your eye, try to hold that position. Now, once you're here, push the shoulder down and your elbow up. Okay, if you hold that position long enough, you might start feeling that tingly down into your little finger. Okay, so that's the test. And then if you can, it's gonna make it a little bit worse by tilting your head away. Okay, hold that hand position, but then tilt your head away, and bam, mine lights up right there. Not fun. Okay, so now to do the glide, this one's a little bit tricky. We're gonna go back to this position. I'm gonna bring my head the opposite way. And now I'm going to pin the wall over there. I'm going to put a pin in the wall with my fingers still up and tilt my head away. Okay, bring it back, head towards, hand towards. This one's a little bit different. Shoulder down, pin the wall, fingers up. Woo, and I can feel mine pulling pretty good. Okay, there's your ulnar nerve glide. Okay. Any questions on that one? I can't see the chat box, so if can't quite read it this far away. Okay, radial nerve.
No new chats. Thanks.
Okay, thank you. Radial nerve, the way we test this one, your arms at your side. Okay, this one's down low. You're gonna grab your thumb into a fist. You're gonna flex your wrist, extend your elbow, and you're going to what we call, this is movement is called pronation. Okay, this movement is called supination. The way we remember that is that we can hold sup when we put our hands like this, so that's supination. Pronation we cannot. Okay, so pronation is going in. So again, flex your thumb, hold it in, flex your wrist. Pronate, internally rotate your shoulder, tilt your head away. Okay? And if you pull hard enough, you can create that sensation in the back of your hand. Okay, now to do the glide, we're going to tilt towards to start, and then we're going to alternate. Rotate here, rotate here. Okay, so there's your radial nerve glide. Again, not as common as the other two. The other two I've seen quite a few times, but that's your, didn't want to touch on the upper extremity nerve glides without telling you the radial one. Last one, I'm gonna do a little bonus one for you guys. Slide this out of the way. Because I don't want to do a whole video, a whole day on lower extremity, because the only one that really ever affects people is the sciatic nerve. We're going to do what we call the slump test, okay? So you're going to sit on the edge of a seat just like this, okay? You're going to slump all the way down, head down, chin to your chest, extend your leg, pull your toes towards you, okay? And if you feel a shooting pain or something feels like it's firing all the way down your leg, we might have some tension on our sciatic nerve, okay? Now this one I can do a whole hour talk on because there's like 5 different places that this could be coming from and where it could be stuck and restricted. And we also want to, you know, any of these issues that we have, we want to focus on what's restricting that nerve. We want to stretch the right muscles, right? Or release the fascia, whatever. You know, I can get all the fancy jargon you want, but we want to actually remove the restriction too, not just get the nerve gliding a little bit better, okay? So this one, it can be hamstrings, piriformis, low back. There's so many different areas that this nerve could be stuck, but this is just one of those quick little tools that you can add to your day to kind of help get that nerve moving a little bit better. So again, slump test. We're slumping all the way down. Extend the knee, pull the toes up. Okay, hold that, and now I feel it. Now to start the floss, I'm going to sit up. I'm going to keep this leg extended, and now I'm going to alternate. Bring the leg down, slump. Sit up, extend everything, pull the toes up, back down, slump. Up, back down. Can everyone see that? I know my foot's kind of cut off on the screen, but. Okay, so there is your sciatic nerve glide. There are other ways to do this. There's another option. You can do it this way. As if you're lying in bed. You want to sit here like this. And you just do the kind of same thing here. This one's not as aggressive because you're only working one end. But you want to hold this knee up here. And then straighten, pull your toes to your nose. Okay, and there's your sciatic nerve glide. If you have really tight hamstrings, you're going to feel the hamstrings tighten up before you feel the sciatic nerve pull on this one. So that's why I kind of like the other one, because you're pulling from both ends. Regardless, that is my presentation on nerve glides. It's actually a really effective technique to help reduce some of that numbness and tingling. Again, it's not the fix for it. We want to address what is actually restricting that nerve. So again, if this is something you may be experiencing, I'd love to chat with you guys or help you set up an appointment with Gary to do some treatment. That was like yoga. Yes. If I had to recommend one thing to everybody, it would be yoga, man. Just all the benefits that you get from it. It's fantastic. It really is. All right. Any questions? How do I get better range of motion in the Batman pose? Work on it. Work on it. We can break up the individual movements. It could be coming from your shoulder. It could be coming from your elbow, your wrist, just about everything. But you kind of want to, you can assist it, whatever you need to do. But yes, the Batman pose, you got to be able to get into that to be able to test it. Anai, would you mind sending that link one more time so people can get their points? All right, guys. Well, thanks again for coming. There's my 15 minutes. I'm doing pretty good at keeping it at 15 minutes. So I'm proud of myself on this because I can talk about this stuff for a very long time. Again, if you have any questions, shoot me an email. I'll hang out on camera for a little while longer in case someone wants to jump in. But other than that, have a good day. Enjoy your points.
Thank you.